Geriatrics lecture. Why do we study geriatrics? The aging population, there are about 40.3 million people in the U.S. over the age of 65 as of 2011. And it is projected that 1 in 5 Americans will be 65 and older by the year 2030. As we age, sometimes diseases are more prevalent. Therefore, it is important to study geriatrics and the diseases associated. Here is a graph that shows how geriatrics and the aging population and what the trend will be in the years to come. As you can see, there is a significant jump between 2020 and 2030. This is due to the baby boom population coming of age. Facts about aging. Aging is progressive, universal, and a slow process. No diseases are specific to aging. Interests, personal and financial resources, family structure, genetics, attitude, all play a part in how one ages. Some lifestyles that may play into the aging process are smoking, misuse of chemicals such as alcohol and drugs, type of diet, and lack of exercise. Myths about aging. Senility is inevitable. Diseases are unavoidable. Older workers are less productive. Long-term care is inevitable. No interest in or ability for sexual relations. Resistant to change and cannot learn new things. Aging changes. This includes an increase in arteriosclerosis, increase in the time needed to learn new material, a sharp decline in estrogen in women, an increased risk of osteoporosis, an increase in malabsorption problems and constipation, decreased muscle mass, less elasticity in the lungs, and gradual stiffening of the chest wall, and a tendency to gain weight. Other aging changes are deterioration of joint cartilage, presbycusis and presbyopia, an enlargement of the prostate and weakened bladder muscles. Impotence is not a symptom of normal aging, but can happen to anyone, and menopause causes vaginal narrowing and dryness. Management of these changes can vary, but some things that can be done are regular aerobic exercise and strength training, weight control, a diet rich in fruits, vegetables, and whole grains, and low in fat, avoidance of sun damage of the skin, pelvic muscle exercises such as Kegel exercises, and annual physical examinations with health screening. Caregivers. It is important for the aging persons prefer to remain in their homes as long as possible. Adult daycare centers can provide supervision for older adults who are taken care of by family members in the evening. They also provide respite for a caregiver. We do not see this a lot in the central Wisconsin area, however, there are a few of these adult daycare centers. Assisted living is a facility that is appropriate for older adults who need assistance with some activity of daily living, such as bathing, dressing, or walking. Skilled nursing facilities provide 24-hour medical care and supervision. In addition to medical care, residents receive physical, personal, occupational, and speech therapy. The medical assistant's role is to develop effective communication skills reflective of age-related sensomotor changes, for independence to be reinforced, and aging patients require more time and should be scheduled for longer appointments. Oftentimes, we will schedule geriatric patients for double the amount of time in the clinic to make sure that we can assess and care for all their needs. Communication. Ask the patient directly what is wrong rather than discussing with the patient's family member. Give the patient the full attention rather than continuing with multiple tasks while he or she is speaking. Older people may take a little longer to process information, and they are capable of understanding. Sometimes it's important to break up patient teaching into shorter, more brief periods of time so they can take a little information, interpret it, grasp the concept, and then come back for more information later. Do not hurry through explanations or questions, but take time to review a form or give instructions. Use referrals and community resources for patients and family support. Address the patient with an appropriate title. A lot of times, older people like Mr. John Johnson or Mr. Johnson as to just calling them by first name. And this really depends on your clinic policy and how you call patients. Introduce yourself and explain the purpose of the procedure before touching the patient. Establish eye contact and get the patient's attention before beginning to speak. Use expanded speech, gestures, demonstration, and written instructions in block print to help communicate with your patient. Repeat the message as needed for understanding. Observe the patient's nonverbal behaviors as cues to indicate if he or she understands. Allow time for the information to be processed and avoid distractions. Involve family members as needed. Also, another important tip is have the patient repeat back to you what you just told them to ensure that they fully understand what they need to do. Advanced directives provide written instructions that specify the type of medical care a person wishes to receive in the event that he or she becomes incapacitated. It designates somebody as durable power of attorney and authorization of making medical decisions if that individual is unable to make it his or her own treatment decisions. Provide a list of specific instructions for a proxy to follow. This can include DNR or do not resuscitate orders and the use of life-sustaining treatments. A copy should be included in the patient's medical record. And advanced directives are only for geriatric patients. Actually, everyone should have advanced directives and a power of medical attorney on file over the age of 18. Elder abuse, poor general appearance, and poor hygiene are often common. Patterns of changing doctors and frequent emergency room visits are common. Skin lesions, signs of dehydration, bruises, abrasions, welts, burns, and pressure sores are often common in elder abuse. Recurrent injuries caused by accidents, signs of malnutrition or weight loss without a related illness, an injury that does not fit the given history.